Other companies in the telehealth space are expanding as they adapt to help people stay healthy while staying at home. One of them is Heal, number 13 on CNBC's Disruptor 50 list this year. Julia Boorstin joins us now with Nick Desai, the CEO and co-founder of Heal. Julia?
Thanks, Kelly. And Nick, thanks so much for joining us. Nick, from other telemedicine companies, because it is our pleasure. Congrats on being named to the list. But Nick, I want to hear about how Heal is different from other telemedicine companies, because you started off really being focused on doctors' visits to people's homes and added the telemedicine component later. How has your business changed in the wake of coronavirus?
Well, fundamentally, we're a different company because we believe that the doctor's office is dead, and we want to bring the doctor to you. And whether that's to your house in person or whether that's to your phone screen virtually, that's our model, right? Is that the doctor should always come to you. So while we still do, and we continue to do thousands of house calls every month, the telemedicine business has grown, obviously, with coronavirus, so people can get the same great care from a qualified board-certified doctor without having to leave their house and without having to expose themselves to anyone's germs just on their smartphone or any browser screen.
But I guess my question is, if people don't want to expose themselves, is the risk of letting a stranger into your home so great that it's going to really minimize the potential for that in-person part of your business going forward?
No, I don't think it'll minimize the potential for the in-person part of the business. Last month in May, we did a record number of house calls in spite of COVID because our doctors and we as a company are taking all of the precautions in testing and personal protective equipment. But when a patient is potentially exposed to COVID-19 or a doctor is potentially exposed, or if a patient just doesn't feel comfortable, we want that doctor and patient to be able to interact without having to be on the phone. So without having to be in person, so that the doctors are able to deliver care virtually. And one of the things that's happened with COVID is people are ignoring everything from pediatric vaccines to their diabetes and hypertension and everything in between. And our doctors are able to talk to patients over video to help manage their diabetes or send a pediatrician to their house to make sure their kids stay on track. So while avoiding COVID-19, they don't end up coming down with the measles. So having both modalities of care is what really differentiates us in the marketplace.
And you recently also launched a telehealth service focused on mental health issues. What has the demand been there, and what do you think the potential is?
The demand has really been overwhelming. It's exceeded our best expectations because people are suffering from what I call, and I'm not a physician or a clinician, but sort of COVID-related stress syndrome. But then there's also all of the stress of the zeitgeist of the time, right? In the aftermath of the George Floyd murder and the protest, African-American and minority families are feeling understandable anxiety. So they're reaching out for the service as well. And we're proud to be able to help them. And the beauty of Heal is that often it's the Heal primary care doctor that is referring you to the clinical psychologist or the psychologist referring back to the primary care doctor. So those two providers can work hand in hand for more coordinated, integrated care that actually positively impacts your health outcomes.
I think you're referencing that in support of Black Lives Matter, you are offering free telemedicine services for a certain period of time. But looking beyond that, what are you doing to address the inequity in the healthcare space?
Well, the first thing we're doing is making quality, affordable, and timely healthcare not related to where you live, right? I live in a West Los Angeles, in the Santa Monica area, where there are tons of doctors' offices. But if you go 5 miles east of here or 8 miles east of here to East LA or downtown, in the lower income areas, there aren't as many doctors' offices. And people don't have insurance, so they end up at an urgent care clinic. And what we see in health inequities is that lower income people are likely to either put off preventative health entirely or pay a disproportionately higher portion of their income for urgent care because they don't have access to quality primary care. So by delivering house calls to all people in all neighborhoods, in all of our markets, we're addressing that inequity. We also work with Medicaid programs in many states, and we also have very low affordable cash prices so that everyone can get the quality, timely health care that we need, that they need. We fundamentally believe that healthcare is a human right. And while we are a for-profit company, we want to make it as affordable, as easy to get for the lowest income person and the highest income person, because everyone should get great health care independent of their economic status.
Great. Nick Desai, CEO and co-founder of HEAL, thank you so much for talking to us today.